Hi, welcome to Medicoria. In today's video, we shall be talking about cervical cancer. We shall be discussing those factors that put certain individuals at a higher risk of developing cervical cancer, and as well as discuss a few measures that one can take to prevent the development of cervical cancer. Almost all cases of cervical cancer have been linked to a virus known as the human papillomavirus, HPV for short. This virus is acquired through sexual contact. When the virus is acquired through vaginal sex, it can lead to cervical cancer. In males, the virus is known to cause cancer of the penis. If the virus is acquired through anal sex, the virus can cause cancer of the anus, and if it is acquired through oral sex, then it can cause cancer of the throat and sometimes cancer of the mouth. Throughout their lifetime, most of the people get infected at least once with the HPV virus. However, for most people, their immune system is able to clear the virus completely from the body. But in some individuals, the HPV virus is able to establish a chronic infection, which can potentially progress to the development of cancer. There are different variants of the HPV virus. The variants that are associated with the majority of cases of cervical cancer are known as the high-risk variants. However, there are low-risk variants that have a lower potential to cause cancer of the cervix, but they cause other lesions such as genital warts. That being said, one of the very important risk factors for the development of cervical cancer is early sexual contact, especially if a girl starts to have sex below the age of 18 years. The other risk factor is if a woman has multiple sexual partners, or if her sexual partner is a promiscuous sexual partner. For example, if she gets married to a man who is not faithful to her. I also need us to remember that there are a lot of people who are infected with this virus, but yet they show no symptoms at all, and yet they have the capacity to transmit this virus to other people. Research has also shown that women with a history of other sexually transmitted diseases, especially chlamydia and others, are at a higher risk of developing cervical cancer. This is because these other sexually transmitted infections tend to facilitate the successful colonization of the cervical mucosa by the HPV virus. In that case, if you must have sex, you need to stop and use a barrier method such as a condom. You can also strengthen your immunity against the HPV virus by getting the HPV vaccine. The other important risk factor for the development of cervical cancer is having a weakened immune system. By far, the most important cause of a weakened immune system is the HIV infection. Therefore, if you are a person living with HIV, you need to screen for cervical cancer more frequently than other people. One's immune system can also be weakened by diseases of the immune system, generally classified as primary immunodeficiency. The immune system can also be weakened by poor nutrition or by drugs that suppress the immune system. These drugs are usually prescribed for individuals who have received organ transplants in order to weaken the immune system so that it does not attack the newly received organs from another individual. The drugs are also prescribed for individuals who are living with autoimmune disorders. Other risk factors for the development of cervical cancer lie within our lifetime. Women who smoke cigarettes are at a higher risk of developing cervical cancer than women who do not. Studies have also shown that people who feed on a diet that is deficient in the different vitamins are at a higher risk of developing cervical cancer. Therefore, you can prevent cancer of the cervix by avoiding smoking and by feeding on a healthy diet. Also, women who do not have access to screening services or those who have access but do not make use of them are at a high risk of developing cervical cancer. This is because through screening, health workers are able to identify cervical cancer even before it actually becomes a real cancer. That is to say, when it is still in a stage that is known as the precancerous stage. So when someone screens regularly for cervical cancer, chances are high that it's going to be detected before it becomes an actual cancer. And these lesions can be destroyed using simple methods such as thermocoagulation, cryotherapy, among other techniques. In the event that cervical cancer has already developed, it will be detected at a stage when it is still possible to treat it. Research has also shown that the use of oral contraceptive pills for very long periods of 5 years and over increased your risk of developing cervical cancer as well as breast cancer. The irony here, however, is that these same pills decrease the risk of developing a cancer of the uterus known as endometrial cancer. They also decrease the risk of developing colorectal cancer. But use of the pills for shorter durations than 5 years do not pose a significant risk for the development of cervical cancer. Still on the use of contraceptives, there is one contraceptive method that has been shown to decrease the risk of developing cervical cancer. That is none other than the intrauterine contraceptive device, IUD. Studies have also shown that women who have carried more than 3 pregnancies to term are at a higher risk of developing cervical cancer. Therefore, it is good advice to bear no more than 3 children. There is also a genetic component to the development of cervical cancer. About 1% of the cases of cervical cancer can be accounted for by genes that are inherited from first-degree relatives. However, 1% forms really a minor proportion of all the cases of cervical cancer. Therefore, if you have a first-degree relative who suffered from cervical cancer, you are advised to screen for the cancer more frequently. I will be discussing the recommendations for the frequency of cervical cancer screening for the different groups of women in a separate video. I will also talk about the different symptoms of cervical cancer in a separate video. Otherwise, thank you so much for watching till the end. If you enjoyed the video, do smash the like button. If you do not want to miss out on similar videos in the future, do subscribe to the channel and turn on notifications. And if you have someone out there that you care about, do share this video with them so that they can learn something new about cervical cancer. See you in the next video.